Back now on Triad Today, and always liking we can spend a few minutes with this lovely lady. She's been with us before, and she and her team and the good folks at Mountain Valley Hospice and Palliative Care do so much for so many people, and we appreciate that. We're talking about, of course, Kristie Byrd, who's Director of Inpatient Units for Mountain Valley. Good to see you again.
Thank you. Good to see you.
Now, most hospice patients receive care at home. We know that. We did that pretty much with our parents. But you also operate 2 hospice homes.
Yes.
Where are they located?
We have one located in Dobson, North Carolina, and one located in Yadkinville.
And now, let's say the one in Dobson, you've served, what, thousands of people, patients?
We've served over 7,000 people since 2009.
Now, I know we didn't rehearse this or anything, but when is it, and Kristie, when is it appropriate for a family or patient to sort of decide, well, maybe we started out with hospice care at home, but we really ought to go to a hospice home? When do you make that decision? Why do you make that decision?
Sure. So most often our patients come because they have a symptom that can't be managed in the home. And they may come to the hospice home and then they get to go back home once we get that symptom managed. Other times they come to the hospice home and they may pass while they're there. And then we also offer respite care. So if we have a caregiver who is experiencing burnout, they may want their patient, their loved one to come there for a 5-day respite.
Okay, that's a good idea that you can do that for the families and the caregivers. So if you're receiving hospice care at home, you're the principal caregiver, you can call up to your team and say, look, can you do the 5-day respite thing? I need a break. And then so you take the loved one to the hospice home and bring them back.
Absolutely, yes.
That's great. Now, I understand you made a number of upgrades and improvements to the hospice home in Dobson.
Yes.
So now, what are the patients and family members going to see after these upgrades?
Right, so during the pandemic, we had to close several of our common areas. And so over the past year, we've been able to open those back up, which has been wonderful. And so we've upgraded things like furniture, we've got new paint on the walls, a lot of things just to make it feel very comforting, welcoming, and it's bright. So we want our patients and families to feel like it's a home away from home.
Yeah, it is definitely not an institutional looking place. It's a comfortable place where people can sort of look out, and then the garden areas and that type of thing.
Absolutely. We have a beautiful garden area. We have a theater room that we're getting ready to reopen. So we just have lots of places that our families can congregate and be together with their loved one.
I want to remind folks at home that Mountain Valley, unlike some hospice agencies, Mountain Valley is nonprofit.
Yes.
What does that mean in terms of patients, maybe, who can't afford it? You don't turn people away.
We never turn anyone away who can't afford care. So if they need hospice care, we're going to make sure that they receive the care that they need and deserve at end of life.
Now, that also means there's a more responsibility for you and your team when it's a nonprofit. You don't turn people away. There's a little bit more pressure on you to say, look, we need to have donations made. And
Absolutely.
So you have fundraising events once in a while, right? Mm-hmm.
Yes, we have fundraising events, and people can always make monetary donations. We rely heavily on our community, and we have wonderful, strong community support, which is great. They can do that through monetary donations, meals, snacks at the hospice homes, and also volunteer. We always are looking for volunteers.
I was going to ask you that. You read my mind, because there's so many things volunteers can do. Give me an example of something a volunteer can do.
Sure. Our volunteers come most days. They are visiting with our patients. They also make phone calls to our patients at home. They can visit patients in the hospice home or at home, so that's wonderful. They do administrative work, answer the phones, help us with mailings. There's a list of things that they can do.
And we're going to give the website in just a second here. And when we do, that means that you can use that website, go through it, find out how to make a donation, or if you want to volunteer, there's a little things that you have to do to get qualified for that. So I hope people will do that. Up on screen, mtnvalleyhospice.org is the website, phone number and everything's up on screen. I hope people will check that out. Kristie, hope you'll come back soon.
Thank you.
Thanks for everything you do. We'll be right back after this.
My mother passed away on a Monday night. My dad and I were with her. What would have been a dreadful experience at home was a blessing at the Woltz Hospice Home in Dobson. Mama was safe and comfortable. So were we. We were even able to bring our dog Gracie for a visit. From their in-home care to their hospice homes to helping us after she was gone. The people at Mountain Valley Hospice made us better people and became family.
Veterans,